Well, should kids brush their teeth at school? Who knows, but we're talking about kids' oral health in tonight's Ask the Doctor segment with Dr. Katie Foster. She's a pediatric dentist with the Smile Shop. Okay, Dr. Foster, should kids be taking toothbrushes to school?
Well, you know, the more times you brush your teeth a day, the better.
Really?
That's what I would say.
Okay.
Yeah, absolutely. But it is kind of unreasonable to expect that of kids. So
Yes.
every morning, I recommend brushing your teeth prior to going to school, and then every evening, right before going to bed, and then also incorporating flossing once a day as well.
How do we get that into our kids' just normal routine? What are some tricks and tips? Because it's a hard thing to get kids to do.
Yeah, absolutely. So practice makes perfect. I always say that introducing the parents into the brushing, helping the parents, the parents helping the children brush until about the age of 8 or until they can tie their own shoes. That's when they have that manual dexterity and they're able to do so themselves. Making it fun for them, so letting them pick out their own toothbrush, you know, whatever their favorite character of the day or week is, maybe one of the spin brushes, you know, those are all exciting, fun ways to do it. And then also picking out a fluoridated toothpaste that the kids like, that they enjoy the taste, the smell, and then they'll enjoy it a little bit more.
Well, and I was going to bring up fluoride. So what are the recommendations on that? Because we do not fluoridate our water here like many communities.
Right. So that's a pretty in-depth kind of a multifactorial question. With fluoride, it is based all on risk. So the child, if they are at a high risk, a moderate risk, or a low risk. And that's something that we do evaluate as pediatric dentists when those children come in and see us for their visits. We're constantly monitoring that every, 6
High
months.
risk of what?
High risk of forming cavities.
Okay, so
Yep.
if you're at a high risk, you definitely need that fluoride.
Exactly.
If you're at a low risk,
You may not need it. Yep, so just using that fluoridated toothpaste morning
is
and
enough.
night.
Okay, because they say that when the kids were younger, they'll probably swallow a little bit of it and then actually get some of that fluoride into their system.
Right, and that is true. And then also kind of what we call the halo effect. So getting it from other foods, that's incorporated into that also, gets inside of their body as well.
Well, let's talk about food because that plays a role in dental health, doesn't it?
Absolutely.
So you want to eat healthy, watch the sugary drinks, I would assume.
Yeah, so, obviously having a well-balanced diet, the single serving of fruits, vegetables, having the poultry, the dairy incorporated in there, and then limiting the sugars, the fermentable carbohydrates, the starches, so the fun things like the chips, the crackers, the candy, maybe, doing that on special occasions instead of daily.
And how often should a child see a dentist?
Absolutely, every 6 months, that's, twice a year. Sometimes kids like to come and visit us more, and we absolutely will take them more.
All right, Dr. Foster, we certainly appreciate
thank you.
it.
I appreciate it.
Yeah, you bet. She'll be taking all of your questions until 6 o'clock tonight. Just dial 858-2222.